Sure. Good afternoon. My name is Marjorie Tingle, and I'm going to be your conference administrator for the Symposium this afternoon, along with Trinice Beaver. Today, we are so excited to have with us today Mr. Andre Harris. He'll be speaking on racial bias and improvement of care. We welcome you, Mr. Harris.
Thank you for having me.
Thank you.
Well, thank you, Carla, and nice to meet you, everyone that's on the Zoom. I appreciate you coming out and supporting. I've known Carla for several years now, and I'm very proud of what she's doing with kids conquering sickle cell disease. We were just talking before we got started about how we miss the community due to the coronavirus pandemic, but we're glad that we can still collaborate on Zoom. So this session is entitled Racial Bias and Improvement of Care. And I really want to just highlight some things that affect the sickle cell community. Of course, we know that sickle cell disease is not a Black disease, but because of the myth that people think that it is a Black disease, and the fact that Black people in this country are disproportionately affected negatively by this disease in this country, it is imperative that we elevate and amplify the racial biases that we see in the healthcare system, and find ways to improve the value and quality of care that sickle cell patients receive. Whoever is controlling the slides can go to the next slide. So before I get to racial bias and what it is and all of that, I really want to also, Carla and I was talking before the session started, and I don't think that World Sickle Cell Day and Juneteenth are on the same day by happenstance. To any of our knowledge, we don't believe that that was on purpose, but I also do believe that it is by divine providence that they're both on the same day. We cannot talk about sickle cell in the country of the United States without talking about slavery in the United States. Sickle cell probably wouldn't be in the United States as it is today if it was not for the transatlantic slave trade. And so World Sickle Cell Day and Juneteenth falling on the same day, to me, really exposes the intersections between race and this disease. Without a shadow of a doubt, the origin of sickle cell disease leads us to believe that the transatlantic slave trade played a pivotal role in introducing sickle cell disease into the Americas. I have complete assurance that there were slaves here that suffered from sickle cell disease, and more specifically in the state of Texas where I live, where Juneteenth is heavily celebrated, because this is really why we celebrate Juneteenth, is because of the state of Texas. I'm sure that there were people who suffered from sickle cell disease and had to bear the burden of building this country on their backs. So I want to highlight that intersection and just make sure that we understand the weight of observing both days on the same day, and allow that to inspire us to continue to move forward and look for change. So what is racial bias? So racial bias, one definition calls it a personal and often unreasonable judgment made solely on an individual's race. An example, if you're out, if me as a Black man is out grocery shopping and a white man or a white woman crosses the street or clenches their bags or their purse when I walk by. Another example is when someone is maybe of Latinx origin, and that person is praised for their ability to speak fluent English, not knowing that English may be their first language and they may not even speak Spanish or another language. These are just very small surface level definitions of what racial bias is. But racial bias is basically making a judgment of someone simply because of their skin color, their race, their ethnicity, their origin. And these can be boiled down into micro and macroaggressions. They could be boiled down into other subsections. But racial bias is the overarching umbrella of all of these issues that really explain why people treat people differently solely because of their race. Racial bias in the healthcare system, we see it a lot with sickle cell patients because I'm sure many of us that are listening know that for centuries, for decades, for generations, the healthcare profession, the healthcare field has been mistakenly believing that Black people could bear pain more than those who were not Black, or that they could tolerate pain more than their non-Black counterparts. It was believed that because we were Black, that we wouldn't even need to have the same amount of pain medication because of that. And of course, if they had those type of those mindsets and those ideologies, it's going to spill over into how they treat people with sickle cell. Next slide. So again, I'm segueing into racial bias in healthcare. Healthcare is a main setting where we see racial and implicit bias. As I said before, I also want to mention something I didn't put on the slide. Dr. Martin Luther King had a quote where he said that healthcare injustice is one of the most, and I'm paraphrasing, but healthcare injustice is one of the most grotesque injustices there are, because it's a sad day when you are sick or when you're in pain and someone can't even show you the very minute level of humanity just to be able to help you out of that pain or to help you get better. And one thing my grandmother has always said since I can remember is that sometimes it's sad, but some people treat their dogs better than they treat Black people. And it's a sad reality, but it's very true that we have dog health insurance. We have dog medication for diabetes that's cheaper and more available for some people who, have dogs with diabetes. And then those who are humans who have diabetes can't even access their medication because they can't afford it. That type of parallel is mind-blowing. But healthcare injustice is very grotesque. For me, not being able to go somewhere to present and say I'm sick and be able to be treated with compassion and respect, it's mind-blowing. And so the main setting that we see implicit biases are very present. It's defined when people make judgments about you and your disease solely because of your race. Black children are often not treated as children at all. There's something called the adultification bias. And so when we think about Black children that may have sickle cell disease, again, if the caretaker, if the provider is believing that Black people don't feel pain as their non-Black counterparts do, and a Black child presents to the ER in a sickle cell crisis, of course, mistreatment is bound to happen. And so these are the issues that we face. A lot of providers believe that we should just give sickle cell patients Tylenol and let them tough it out. Of course, we know in 2021 that that's just inhumane at this point. Next slide. Also, bias affects the way that we think. And so there is a book, and I meant to bring it with me. I don't know. I may be able to find it during the Q&A that I want to show you all, and I meant to put on the slides, but there's a book called Just Medicine that I recommend anyone that's listening to me to purchase, read, check out from the library. But it was written by a lawyer, a health policy lawyer named Dana Bowen Matthew, and it talks about basically this subject ad nauseum about racial bias in the healthcare system and why it exists and how to overcome it. One of those things that she talked about, she did mention sickle cell, but other diseases that impact the Black community. But one of the things that she talked about is how biases affect the way that we think. Those who are providers that are perpetuating these type of biases, they're thinking is skewed because they've been socialized to believe these things are true. Again, if you were taught in medical school, which I have encountered providers who were taught in medical school some of these inherently wrong things. If you were taught that Black people are the only ones that get sickle cell. I had a biology professor when we got to the genetics portion of our curriculum, and he mentioned sickle cell disease. He at the time, he was in his, I think, late 80s. And I think he went to medical school in the 50s. And so a lot of the education that he received was antiquated, especially concerning sickle cell disease. And he was teaching another generation of would-be doctors or whoever it may be, that sickle cell patients are always Black, that they always die early. And he was making a lot of general claims. And of course, I refuted them, but my point is that we have to be able to find a way to myth bust and educate people about what sickle cell is. Even those that are in medical school who have MDs and PhDs, just because you have an elevated or a higher degree doesn't mean that you know all or are just a master of all. You're a master of that specific dissertation that you wrote, but there are different topics that you may not know about. So it's very important that we challenge the way people think, their attitudes, their perceptions towards us. Racial biases are evident when providers and healthcare professionals deny Black and Brown patients access to the same treatment. I'll give a very brief example of that. For many years, when I was in crisis, I would be admitted to a hematology oncology wing or floor where we shared the same floor with the cancer patients. And I could tell you firsthand that whenever I was sick and I was admitted to the hospital, the cancer patients definitely got a different standard and level of treatment than I did. And most often than not, they were non-Black, and most often than not, they were of a higher socioeconomic status. And so we see this in real, it's just not something that's in a textbook or that we're learning in this course, but I've experienced it. I'm sure people on this call who have sickle cell or have children with sickle cell have experienced that they have seen tangible ways that people have discriminated against them simply because they were Black and simply because they have sickle cell disease. Sickle cell disease patients suffer from being denied narcotic or opioid medications due to unfounded concerns of addiction and drug-seeking behavior. There is a plethora of evidence that shows that sickle cell patients are not prone to being addicted to their prescription opioid or narcotic medication. The unfounded fear that providers and PCPs have of prescribing opioid or narcotic medication for pain management is just that, it's unwarranted. There is no empirical evidence that supports the fact that sickle cell patients will become addicted to their medication. Of course, there is a risk for addiction, but there's no greater risk. There's no concern for someone who has sickle cell. And I'm sure a lot of people on this call may have said this, but again, coming from not only an advocate perspective, but as a patient, if I wanted illicit drugs, if I wanted to get high, the last place I would go to is an emergency room to wait for 8, 9, 10, sometimes 12 hours, just to get a milligram or two of Dilaudid, when I could easily go on a street and buy street drugs or buy weed And so the rationale to me doesn't even make sense for why providers would believe that we are drug seeking. Next slide. Improvement of care. How do we do this? And so this is where I'm going to nerd out a little bit. And I'm also exhausted I'm in summer school. I just got done doing, I'll explain what I just got done doing, but I am recovering and exhausted and I sleep so much. If it was said already, please forgive me for being redundant, but I just got done interning at the Texas State Capitol for our 87th legislative session. And so I'm going to nerd out about policy and advocacy a little bit right now about improvement of care when we talk about racial bias in the healthcare system, especially when it talks about sickle cell patients. So for federal and state legislation, and please, I'll give a preface. Whatever I say is not to be condescending, not to insult intelligence, but to really expose the issues at hand. If you're doing this already, I commend the work. If you're doing this already, I really appreciate you. If you're not, I'm not trying to shame you. I really am trying to motivate people to do all they can do at this juncture. So federal and state legislation, I think a lot of people get federal and state legislative processes a little confused. So I love to just kind of tell people when we vote, when we encourage people to vote, it's very imperative to vote for your Congress people. It's very imperative to vote for your president, but we also need to show up for state elections. Your state officials, your senator and your representatives at the state level are very beneficial. And again, as I'm saying, if you're doing this already, and if you're not, it's not to make you feel bad. I just really want to expose that this is very important. So I was privileged to work with State Representative Jarvis Johnson. He is a Houston representative, and he has been a staunch advocate for sickle cell disease in the last few sessions here in the Texas State House in the legislature. And so I'm a current student at the University of Houston's Graduate College of Social Work. I'm majoring in, I'm getting a master's and a PhD in social work. And so to satisfy my field placement internship for my master's, I had to do an internship, and I chose to do the legislative internship. And so I was just so happened to be lucky enough to apply to the school, get accepted, apply to the program, get accepted. I met Representative Johnson through, some people may know Tanya Prince here in Houston from the Sickle Cell Association of Houston several years ago. And the fact that I was able to work with him came full circle. So I was able to work with him, and we introduced 3 bills in the Texas House concerning sickle cell disease. Unfortunately, 2 of them did not make it to the governor's desk to be signed and implemented into law, but 1 of them did. But it goes to show that there is fallow ground that could be broken up in the state houses wherever you live, where you can plant seeds to change what's going on with sickle cell patients in your state. Of course, we need federal legislative change and reform. Of course, we need those type of initiatives at the federal level and at the national level, but we also need to focus on the state level. And this internship really drove that point home for me. So I say that to say, as a segue, is that in order to improve healthcare, we really have to figure out a way to get into our respective state houses, meet with your representatives, meet with your senators, and really educate them on sickle cell. And so whenever your next legislative session is in whatever state you live in, if you don't know, look that information up. If you need help, I'm more than happy to help you. If you are part of a community-based organization, If you don't have one already, get a legislative or policy team together. Find out, survey your community, find out what the community needs, what the community wants. I did say that I'm a social work major, and so I also have my undergraduate degree in social work. And one thing that we were taught and one thing that we learned when it comes to social work, it is offensive and inherently distasteful for someone to go into a community and tell that community what that community needs. So as a social worker, if I went into a community and said, you need a park, you need this, you need that, and I'm barking orders at you and telling you what you need and never listening and asking what you want, my job is not being done. And so I use that same lens for this perspective. Look to your community, ask the patients, ask the caregivers, ask the community what it is that we need. And then you present that to your senator, your representative at the state level, and see if they're willing to introduce legislation. That's really a crash course on how that happens. Of course, there's a lot of things that go on the background that makes a bill into a law, but just like the scientific method, in order for you to test a hypothesis, you first have to present a question. And so you have to find a question, what is the problem? And then that problem statement can evolve into a bill being filed, and that bill being filed can evolve into policy change. So that was a long-winded answer to say this is one of the reasons and one of the ways in order to prove healthcare, especially on the state level, and especially with racial bias. There's a lot of things, and I said this on another call, there are a lot of laws, especially at the state level, that have been held since Jim Crow era that are very racially motivated, that a lot of people don't know are still in law today. There are a lot of laws that restrict or prohibit people of color, especially in the South, the Deep South. So there may be a way or an avenue for you to either abolish an already standing law or present another law to help improve the healthcare of those who are people of color and of marginalized populations. You can go to the next slide. All right, so I'm almost done. Improvement of care again. So evidence again, as I said, I'm a graduate student and I'll be embarking on a PhD in August, and I did undergraduate research in my undergraduate program. So being a researcher, we love empirical evidence. And so evidence has shown that disparities between sickle cell disease and other genetic disorders such as cystic fibrosis, Tay-Sachs, stem from race and impact on research productivity and development. So what does that mean? There are a lot of publications that try to expose the disparities between comparable diseases. Cystic fibrosis is comparable to sickle cell disease in several ways. Cystic fibrosis is a rare disease. Sickle cell is a rare disease. Cystic fibrosis primarily disproportionately affects a certain race. Sickle cell, it's Black, the Black race in this country. Cystic fibrosis disproportionately affects white people in this country. And then there are a lot of other things that we found that cystic fibrosis is one of the, and Tay-Sachs are one of the most comparable rare genetic disorders that we can compare to. And so when we see the funding between both diseases, there is a huge disparity. So cystic fibrosis, if I'm not mistaken, is funded per person, I think 4 or 5 times greater than sickle cell disease. Cystic fibrosis has about 60,000 people in this country, and I think that's a very generous estimate. Sickle cell is estimated to have 100,000, and we believe that, of course, that there's more, but we don't have access to the appropriate surveillance data. So what am I saying? I'm saying for a community that is a rare disease, genetic disease, And it also characterizes itself with episodes or crises and bouts in the hospital and organ damage and all of these things. Why not? Why is there not parity between research funding and dollars when it comes from legislative bodies or even private corporations? Really, the only thing that researchers have been able to find in a lot of these publications that I pulled from and that I've done research and reviews on is the fact of race. The only difference is the race, is that cystic fibrosis and Tay-Sachs affects primarily white people. They have more money than we do. And why is that? Because of race. Implicit bias training needs to take place for all incoming medical students, yes, but that is not where the work needs to stop. Implicit bias training is imperative, yes, it is, but that is not also the cure-all. We have to be able to not only in the legislative arm be able to educate and acknowledge the disparities, but we also have to educate not only the public, but the healthcare arena about these disparities. Elimination of racial bias would, one, lead to more accurate diagnoses, two, lead to a better pain management, and three, save Americans $310 billion annually. A report said that if we eliminated racial bias in the healthcare system, our country would be able to save at least $310 billion. Now, for a lot of those that are involved politically and civically, we know that a lot of people from across the aisle are fiscally conservative. And a lot of times when we present progressive reform, especially in healthcare, cost is always an issue. And so if we can make the case that we can save $310 billion and there's still really not movement going on, then really I don't know what else to do. I think that's really the biggest way to make a case for why we need healthcare reform. And I will also say, I like to read books. And so when I do presentations, most of the times my presentations, I use books and journal articles to present or support my claims. So I also want to take a shameless plug and say, I recommend a book called The Healing of a Nation. And I hope I'm saying that title right. For some reason, it didn't sound right, but I'll give it to Carla or whoever the admin is if you all are interested. But it's a book by a New York Times retired reporter, and he went to, I think, 7 different countries and surveyed their health care system. And the United States ranked almost last out of several different countries. And it's sad that we are one of the most powerful countries, the powerful country in the world, have so much money at our disposal, but our healthcare system is really crumbling at the foundation. And this is also my shameless plug that I believe in Medicare for all and sweeping massive healthcare reform. And I really think that in order to eliminate racial bias, we also need to be able to promote health equity. Equity and equality are 2 different things. Equity gives people an advantage that are already at the start going to fail. Equality is okay, but when we think about equality, that means everybody gets the same thing, the equal amount. And unfortunately, for those who are African-American who were brought here forcibly from their homes 400 years ago, 400 plus years ago now, equality doesn't really do much for us. We need equity. We need that extra boost. We need that that level playing field. And I'm falling down a rabbit hole, so let me move on. Next slide. Oh, that's the end of it. So yeah, equity and equality really highlights the fact that racial bias in this country is really going to be an equity issue than an equality issue. In order to fix it, we're going to have to come from an equity standpoint instead of the equality standpoint. Equality is good at a certain extent, but as I said before and I explained before, for these type of racial issues, for people who have been historically disenfranchised since we arrived 400 years ago, equality will never work. We have to use it equity lens. And so that is my presentation, and I think we're doing Q&A now.
Thank you so much, Andre. I appreciate you. And as you know, we have just the privilege of having you here. I thank you. If anyone has Q&A questions, just put them down in the chat. I want to just have some conversation and dialogue with you because you know we have spoken about racial bias before, especially when addressing the community. One of the things that you mentioned in your presentation, how important it is for us as a community to go out and speak with our legislators that are working on our behalf, those that are in the House and Senate. So I thank you for mentioning that. Can you tell us, you know, just how a little bit about how that has impacted the sickle cell community thus far?
I'm sorry, I'm muted. Yeah, so it is very impactful. And again, like I said, I guess I am very biased now after I came out of my internship. But even before that, Carla and I have gone to Rare Disease Week at the Capitol in North Carolina, where I lived at before I moved here to Texas to go to grad school. I lived there for 16 years, and one thing that was very impactful is the founder of our sickle cell community-based organization was a state representative in North Carolina. She just recently passed, I think, a year ago. But she opened one of the first sickle cell, one of the first SCDA constituent organizations in North Carolina, in Fayetteville, North Carolina, in 1974, I believe. She's one of the first, not the first. But North Carolina has always been a leader in sickle cell disease. And so I was privileged to be in their company growing up, like I said, for 16 years. So whenever North Carolina had a legislative day for sickle cell, and I was available, I went with my CBO, and I saw, because she was a retired state official, how beneficial it was. Even in North Carolina, there's a state senator named Gladys Robinson, who she has the same bio. She has been in sickle cell for over 50 years. And her organization in Greensboro, which is directly across from North Carolina A&T, has been a powerhouse. And she has been an advocate in the North Carolina General Assembly. And so seeing these two women who were state legislators, one a representative, one a senator in North Carolina, really influenced me. And then we were able to start going to the Capitol. Like I said, I've been with Carla and others at the Capitol and meeting our Congress people about sickle cell disease. Is very impactful, because more often than not, they don't know what it is. They don't know what sickle cell is. If they have heard of sickle cell, again, not to be condescending or arrogant, but they don't have the right idea of what it is. I've heard so much cringy things, and I'm like, oh gosh, help us! You are our lawmaker. But it is always a privilege to have that opportunity to educate them, because if not us, then who? So I definitely admonish all of those that are listening, whoever will listen to the playback, if you're not already involved, find a way, like find your local CBO. Again, I make myself available. There are links that we could show you that there's a CDC directory for sickle cell, and you could click on that directory and find a CBO in your area, the closest one to you, see if they have any type of legislative initiatives. If not, why not introduce them, or at least say that you're interested. These are very simple things, and not to trivialize this, because for some people this is, new and is very challenging. I know that the talk that I'm giving now, if you would have asked me to do this talk 5 years ago, I would have been just as confused as someone else. So I definitely don't want to make it seem easy, but what I am going to make it seem is that you have a community around you, Carla, me, who will be more than happy to help you get to the appropriate resource to be able to influence your state legislator. I think it's very imperative, because again, there are a lot of healthcare policies at the state level that need to change. In North Carolina, there were some policies surrounding emergency room care and opioid pain management care, and a lot of that was biased. We had to fight in order to get sickle cell patients added to certain legislation that talked about opioid usage, because there was only cancer and some other diseases, but they downright refused to add sickle cell disease. So those are the issues that you can make your voice heard and really make an impact on the sickle cell community.
Thank you so much, Andre. I'm always forgetting to unmute, but thank you so much. Another thing that you have mentioned, when we come on to advocating, and when you mentioned some great points that we've come a long way, but we have some more work to do. And when as far as legislative policy, we definitely had the Sickle Cell Surveillance Act with Cory Booker and Tim Scott being able to support us in that, where we know that funding and surveillance is needed for our community, because without the numbers, us not knowing the numbers, and we still are so behind for each state, we still have an idea kind of roughly, and it's not even accurate. We still going on their minimum estimates from years of trying to have some kind of we don't have the data. And so definitely have come a long way. And you've mentioned some great points when you mentioned, compared to other diseases, how we lack funding. And when I think about the work that we do in our community, and I can go on and on, that me and you have been on Capitol Hill, as well as working very closely with our great and awesome SCDAA national our national component. So just knowing that we have great organizations that are there for advocacy and understand this issue of racial bias that continues to move forward. And you mentioned also going to the ER care and not getting treated adequately. So and I will come out to share that even in these times we still experience that. And even just recently, I'll share a personal experience with my child. Even just recently, I'm taking him to the ER with his regular doctor that he pretty much regular hospital system that he always goes to, but there was a particular doctor that was in the ER that pretty much saw that my son was there a week prior, had been admitted, and then we were back that week. He had been, the pain came back. So it was very aggressive, and did not want to treat him with opioids, and told me that he'll probably be back the next week also for more opioids. And it was just like, what? And I did not let him know any further, but kind of use the time to educate him. But of course, using that time also to write their whole hospital system thereafter and let them know what took place, and called his doctor right away. What he didn't know was this was the right mother that day, that he pretty much did not want to treat my child and had my child suffering for a long time before provided the right care, and then had the nerve to say to me, he'll probably be back next week again. And I knew it was a biased situation, and definitely there's so much to still continue to be addressed when we look at sickle cell and having to go through so much, and even in pediatric care, because, you know, I'm looking at my child that's still in pediatric care, but looking more like a grown man now, right? So he's looking more mature now, even though he's young. They seem younger children, and he's about to age out pretty, you know, he has had a couple of years, but he's about to age out. And this is a continuous conversation that we actually have to have with our hospitals, going in and joining those group, the advisory boards, letting us see when the sickle cell warriors and parents and caregivers are well, letting them know that we want to address this, and how could we educate, you know, educate our health professionals and social workers that are there, so we can continue a new momentum on this racial bias. We are going to start to chop down these biased thoughts that are building bridges of just chaos for us as of caregivers and warriors in the community. So I want to thank you for even sharing and just that comparisons of different diseases and treatments. So I will stop there, because, you know, I can go on this subject. So thank you so.
Yeah, we both can.
Thank you so much. I want to take the time to ask our administrators to continue to see if there's any questions or anyone that wants to chime in on this particular topic.
At this time, I don't believe there's any questions.
Okay.
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 I do see, I think her name is Addie, just made a comment about cystic fibrosis. And so and to see her resonate with what I said was reassuring. But very briefly, Carla, you're so right. And there's something I didn't share because, you know, we both can talk. So I was trying to get through my slides. And guys, I was telling Carla that when I was, as a researcher, when you do PowerPoints, they tell you to be very succinct and all of that. But when I did undergraduate research, I would have like 25 slides with 4 or 5 paragraphs and 7 graphs and charts. So this was my first time really trying not to put all of my content on the slides. So I feel like I missed saying a lot of things, but in order to really amplify that, I have experienced racial bias because I was Black, because I have sickle cell. I know one of the last times I was admitted, and it's even more hurtful because the person who did it was a Black woman. She was from, I think, Barbados, or she was from one of the Caribbean islands. And I had requested my pain medication, and she came in with an attitude. Every time she came in my room, she had an attitude. But she came in with an attitude and said, back home, we don't give you all sickle cell patients narcotics because you don't need it. All you need is some Tylenol and to suck it up. That's what she told me. And of course, I was like, I know she, you know, I have to, but these are the things that we are experiencing on a day-to-day basis. And it's not just coming from white people. It's not just coming from non-Black people. It's coming from Black people too. People that look like us. So it's not just a white versus Black thing also. And I think we also need to illuminate that, is that I think sometimes people get annoyed or wonder why we always talk about race, thinking that it's Hatfield versus McCoy, but it's really, everyone needs to be educated about these biases, because she was a Black person and she still perpetuated those same ideologies towards me. Also, I wanted to really just say, as Carla was mentioning, it just brought back to my remembrances. When we talk about racial bias, it brings about it weighs on your body. Racism makes us sick. And again, I love giving out resources. If you go to YouTube, there is a YouTube video by Dr. David R. Williams from Harvard School of Public Health. He's been a professor there for, I think, over the last 30 years, and he has a YouTube video called How Racism Makes Us Sick. The things that I've been giving you are things that I've used ad nauseum in my undergraduate and graduate education to write papers and to educate people. Racism affects our mental health and our physical health. And so when we think about racial bias, and when we think about when we're in crisis, when we feel like we may not make it out of the emergency room or the hospital alive, and we have people questioning our pain, we have people second guessing our pain, we have people not listening to us, of course, that's going to impact us negatively. And so that's why I also push for access and expansion of mental health services for sickle cell patients, because of all of this lifelong worth of not only physical despair, but we have mental and emotional distress and despair too, because for so long people have, I'll even say this last night, and I will say this and be quiet because again, Carla and I, we could talk, but last night, y'all, I've been trying to lose my COVID 15 pounds that I gained last year. So I hired me a trainer, and he actually has sickle cell too. So I felt comfortable. He won't try to kill me. Great. He got sickle cell, so he know how it is. Like, he ain't gonna try to have me running 15 miles a day or something like that. So I've been, posting my little workouts online, just, encourage myself and to make myself feel good. And someone on Facebook responded to me and was like, well, why can't you? I went on a walk. I went on a power walk, and they was like, well, you need to run because running is better and blah, blah, blah. And I said, well, I really don't have that capacity to do that right now. And they were like, well, I told them I don't have capacity because I have sickle cell and, just whatever. I just said, I'm not running. Well, why do you have use sickle cell as a crutch? Like, if you had cancer, like, I can understand, but you have sickle cell, it's not that big a deal. So people still believe that it's a competition. It's not a competition. When we make these type of comparisons, we're not trying to compete or to get a gold medal. I would not like to compete. We're trying to highlight the fact that there are underlying issues that perpetuate why people treat us differently. And so I just wanted to share that. But yeah, I hope after this presentation, people really take away that racial bias really impacts our mental state, our emotional state, our physical state. And then there's things that we could try to do to help it. Of course, with any type of progress, it's like a dripping water on a rock. We may not be able to drill a hole straight through it, but if you have dripping water that constantly hits a rock, eventually it's going to wear down. And so that's how progress works. Unfortunately, everything is not overnight, but when we continue to galvanize for progress, it's another water droplet hitting that rock, and eventually there will be change. So if I don't see change in my lifetime, I know that the work that we're doing now will impact positively the generation behind us, and that makes me feel good.
Thank you so much. This completely awesome, as usual, Andre. You already know. I have to share because it's kind of odd doing things online, and when we see each other in person, we can't help but cut up together because we enjoy what we do, but we also have fun together, and we always have a great learning experience. My friend for years, Andre Harris, just speaking through your experience on this, since you have now advocated not only on the side of speaking with legislators and in the rare disease community, we have joined force because, we believe in joining forces, we're stronger in numbers. And even though a lot of the condition, especially sickle cell is not as rare as we think, but it's under the rare spectrum. So definitely taking the time and making sure that we take time and definitely meet with our representatives. But what have you seen as far as what would you consider progress that you can see coming forth as far as how we can educate and do things a little different to break down these boundaries of racial bias in healthcare?
Yeah, so I'll tell you what my representative that I work for did. And you mentioned earlier about surveillance data and all of that. He introduced, unfortunately, the bill got killed in the Senate, the Texas Senate, but he introduced, and it was passed overwhelmingly bipartisanly out of the Texas House, a bill that would establish a sickle cell disease registry. I think one of the things that we can focus on is really establishing a registry at every state level, and then also mount the cause for getting that national registry. I was on a call with the CDC Foundation, who funded the state registry for California and Georgia, and I think there's 7 other states now that are under this registry. But of course, that's only, I think, 9 states in total, and we have 50 states, and so I think that is very important to really try to get that state level registry implemented. So again, back to what I said about implementation and advocacy and policy. And I also want to say this again, when you are registry data is not only important for sickle cell patients, but also those with sickle cell trait. Because if you like my mom did not know she had the trait when she got pregnant with me. She found out, of course, when she was pregnant, and they, did a test. They did an amniocentesis and found out that I had sickle cell disease. And then my grandmother was like, "Oh, I knew she has 5 kids. I knew that 2 out of my 5 had the trait. I knew for sure which one had it, but I didn't know which other ones had it." So my mom was just that other child that she didn't know had the trait. And I bring that up as an anecdote to say that if there was a robust registry, people would be able to know their status. And even if they didn't, they would have an avenue to find out. I think addressing trait also helps addressing disease, because if we could empower people with the knowledge of their trait status, we could work to eliminating and eradicating this disease. Because if people are informed about their status, they would, not know, they would know, well, maybe I don't want to have a child with this person because they have the trait or the disease, and we don't want to bring a child into the world with this disease. Again, that's their personal decision, just bringing up a point. And so registry data is very, very important, I think. And then also access. If we reform our healthcare system, and it is just the best healthcare system that we've ever seen in the universe, if I don't have access to it, it makes no sense. And I've said this before, if you buy me a brand new car, a brand new 2021, 2022 Maserati, but there's no engine in the car, I can't drive the car. Or if I have an engine in the car and I don't get gas, I'm not going anywhere. So the car, the brand new car, could be the reform to the healthcare system, but if we don't have access, then we're not moving, and it's really not useful. And so I really believe that there also needs to be a reform in access when it comes to transportation, when it comes to insurance, Medicaid, Medicare. These are topics that I'm saying that could be addressed, that can help us impact racial bias, because again, we know, because of the 400 years that we've experienced redlining, denial of access to appropriate transportation, being forced out and and having to live in ghettos. And I'm talking about the African American communities specifically. The access to appropriate K-12 primary education, the lack of access to higher education. These things impact healthcare. All of this impacts healthcare. It's been shown that the social determinants of health are just that. If I have a lack of access to education, it is going to be a higher possibility that my healthcare is going to be lacking as well. And so these are the things that racial bias impacts. And these are the areas that we can target in our advocacy in order to improve care. That's why I've always been passionate. And that's why I'm here getting a doctorate degree in social work, because my research focus have always been social determinants of health and how we can improve those determinants and access and health equity so that patients, not only with sickle cell, but with other diseases, can have a fighting chance to not only thrive in their life with their disease, but thrive in their disease state. You could have sickle cell, not be a death sentence, and thrive. So these are the areas, Carla, as I said, long-winded, as we know, that we could attack and we can address, and that I've seen that people have tackled, and we've seen change. Even though the bill didn't pass, we were able to educate a whole 150-member body about sickle cell, and now there are people in the Texas legislature that are educated and will probably introduce bills in the next session in 2023 about sickle cell disease. I've gotten calls from people in Virginia that they want to introduce bills about sickle cell disease, and they want me to help them with that in their next session. So we really have a fertile ground opportunity where we could get more people involved in finding out what the systemic issues are and addressing those head on, not only from a legislative perspective, but from an educational perspective.
Thank you so much, Andre, for this information. You rock as always, you know. I see a comment in there. It would be nice to have some kind of reference guide on how to approach caregivers. Yes, gently, professionally, but definitely we have to address every single issue when it comes to bias. We have to do it. And one of the things I encourage is to write a letter and let them know. And what I did was document time frames. The time my son came in there, the time he got introduced to, when I told him what treats him well, I asked them to look at the care plan. I made a documentation that when I was ready to write my letter, it went to every single administrator in that hospital. And I don't know if it's because it's who I am here, but I wanted to make sure that they know that this cannot continue. So I definitely know that there definitely does need to be a guide, but we're going to tackle these challenges one by one, but we do need to address it. And what I have to say to you also is understand and learn your health records, like pull your health information, see what people are writing in your charts. And there's opportunities to do that always. Get your health records and read them, read the comments that they're making, be your advocate in that sense also. So we have a lot of work to do in our community, but please join forces with us and our community. We have great organizations that are doing much work, and we join with them. Sickle Cell 101 and the National Sickle Cell Disease Organization of America, as well as Sickle. Ashley is so great. I don't believe that one person or one organization do it. We do it as a united force. So definitely join forces with us so we can definitely make our voices be heard. Thank you so much for this session. We are getting prepared for our next session. Thanks a lot. Thank you so much, Andre. You were so awesome.
Thank you, everyone.
Thank you so much. We definitely received so much information today. Thank you.
Absolutely.